Thank you, Cathaoirleach, and thank you, Minister, for being here today. I want to thank you for coming before the Seanad to enable me to demonstrate why it's absolutely vital that you do and that Minister Harris does everything in your power to address the waiting list for orthopaedic surgery at Galway University Hospitals. And we often hear the numbers of hundreds of thousands of people waiting for procedures and appointments at hospitals throughout the country. But I want you to hear the case of just one individual in my constituency today, and I want to tell you that I have his full permission and the full permission of the family to use his name in this regard, because I think there's nothing that brings it home to people the seriousness of this situation like hearing the individual cases. So his name is Neil McElhinney. He first underwent spinal surgery at UCHG in November 2015. This was a triple spinal fusion which consisted of 8 screws, 3 rods and extensive bone grafting. 2 months later, the screws slipped and broke 2 vertebrae, which resulted in the screws pulling out. He then had a second operation in February 2016, and this time the screws and plates were removed and more extensive hardware was used further up his spine. Unfortunately, he experienced severe pain for several months after the operation, at which time a scan showed that the screws had pulled out of the vertebrae and 4 screws loosened further down the spine. The CT scan showed a haloing effect where the bone around the screws is being eroded with the constant movement. And every time he moves, the screws and the frame moves, and the 4 loose screws further down are causing frame movement. The unimaginable pain that Neil is experiencing every minute of every hour and every hour of every day can only be described as inhumane. To complicate things further, Neil has 2 further underlying diseases. One is scardiosis, which affects the lungs and the muscles and has unfortunately gone into the pituitary gland, which in turn has caused Addison's disease. His consultants understand his operation has to be a multidisciplinary approach involving respiratory, orthopaedic and endocrinology. Neil desperately needs a 3rd operation as his spine is out of alignment. This is called an ostomy, where basically a V is cut out of the spinal column and the spine is either bent or broken to realign it, and the extensive screws and rods are fixed for 2/3 of its length and anchored to the pelvis. His consultant at the time, Mr. Jan, assisted by Mr. Fergus and Mr. John McCabe, organised for Neil to have the surgery on the 26th of September in 2016, and indeed he was admitted to UCHG on the 25th of September and put on a pre-op IV drip due to the Addison's disease, and was advised that he would be first to the theatre on Monday morning at 7:30 a.m. He was gowned and ready for surgery on the 26th, but as there was no spinal cord monitor, the surgery had to be cancelled and Neil was discharged and sent home. Since then, he has been waiting in desperation. His own endocrinologist has said he is in exquisite pain and he is very concerned about the huge amounts of painkillers he has to take. And I quote his consultant, his orthopaedic surgeon, when I say this is a major complex revision spinal surgery which is only performed in 2 centres in Ireland, and the waiting lists for these are serious. This is largely due to failure to provide funding at the necessary level for pathway of care commensurate with the modern spine practice and has not been adequately addressed. Galway University hospitals are also waiting appointment of further consultants. Again, I quote the consultant when he says, "I have patients waiting for as long as 2013 for spinal surgery under my care. I'm not in a position to effect change in the pathway of care unless I get the appropriate funding." Minister, I'm asking you today, can you please tell me today, Minister, how Neil can get this vital surgery he needs? Last week he was sent to UCHG by his GP for a much-needed CT scan. He was hoping to be admitted to A&E. However, there was no CT scan and it was conducted and he was sent home again. When Minister Harris was in UCHG last week, him and his wife, Neil and his wife Kathleen, were there. They didn't have, his entourage passed by, but they didn't have the strength left to speak to him. You see, they have nothing left. They are mentally, physically and emotionally drained. And I am asking you, can a simple question here today. Neil has been given several reasons for not being able to have this vital operation at UCHG, including lack of staff, facilities and funding. He cannot wait in this excruciating pain indefinitely. Can this operation be done in a different hospital, i.e. the spinal unit in the Mater Hospital, as a matter of urgency? And I say it in the context of the desperation of people waiting on the waiting list for orthopaedic surgery and the pain they're going through. And I really appreciate your answer.
Thank you. Well over your limits, Senator.
I understand. Thank you. It's such a serious case.
Thanks, Chair, and thank you to the Senator Conway-Walsh. I'm here on behalf of Minister Harris this morning. I'd like to thank the Senator for raising this issue. With respect to Galway, orthopaedic services, trauma services are provided in the University Hospital Galway, and selective cases are treated at Maryland Park University Hospital. I wish to advise the Senator that most recent NTPF figures indicate that there are 796 patients waiting for orthopaedic inpatients or day cases treatment in Galway University Hospital. Of these, 37 or 5% have been waiting for more than 24 months. 3 patients, which represent less than 1%, have been waiting for more than 36 months. The Salta University Healthcare Group advised that a review of orthopaedic services is currently underway across the Salta Group. The review will be forthcoming shortly. The findings will be forthcoming shortly. It can assure the House that there has been a concentrated effort to address waiting lists and reduce waiting times for orthopaedic services at Galway University Hospital. Now, I can't pronounce the next word, but I'll try my best. Muscular, skill, lethal, psychotherapy services have been put in place and is being expanded to manage approximately 240 referrals per month. Patients are targeted and determined by the consultant as to be seen by the physiotherapist. Galway University Hospitals also provide a dedicated orthopaedic pre-assessment service which helps to ensure that patients are appropriately assessed prior to their surgery and appropriate discharge planning is in place following surgery. There are currently 9 full-time consultant orthopaedic surgeons in position in Galway. 2 additional surgeons, one with a special interest in paediatrics and the other with spinal surgery, are due to be appointed in March and September 2017. I would like to confirm that the reduced waiting times for the longest waiting patients is one of the government's key priorities. It is for that reason that 20 million has been allocated to the NTPF in the budget 2017, rising to 55 million in 2018. Last December 2016, Minister Harris granted approval to the NTPF for a day case waiting list initiative with the aims of ensuring that no patients will be waiting more than 18 months by the 30th of June 2017. In excess of 2,000 day cases will be managed through the process, and I understand the appointment under the initiative will be issued shortly. The HSE is due to submit waiting list actions plans for inpatients, day cases and outpatient waiting lists shortly. The focus of these plans should be to ensure that no patient on either list is waiting more than 15 months by the end of October 2017. The HSE has requested to develop the inpatient day case waiting list action plan in conjunction with the supported by the NTPF's approach for utilisation of remaining 10 million of the 2017 funding for patient treatments. These plans are currently being finalised and Minister Harris will expect to receive them very shortly. Requesting the waiting list action plan, Minister Harris raised concerns with regard to the waiting time across a number of specialties in Galway University Hospital. He expects that particular focus will be given to Galway waiting time as part of the forthcoming action plan.
Thank you. Very briefly, I'm sure, Minister, you're not the line Minister, but you'll convey the very...
I would really appreciate it if you would relay this and this case to Minister Harris, and I appreciate that the review is being done. But for those people waiting on the waiting list, like Neil, a review is of no consolation to them. And to see review after review being done right across the board isn't, action isn't being taken. The consultants are telling us they don't have the resources to do the job, and we have to ask the question: who is accountable? Who is accountable? You know, can we find one person who is making the decisions? Because all the time we're seeing with health is the Minister is saying, passing it over to the HSE. The HSE, it gets lost in the quagmire of people where, again, nobody is accountable. Somebody has to be accountable for leaving people like Neil in excruciating pain for months and months on end. I appreciate you coming in here today, Minister, but I would ask you to speak to the Senior Minister, Minister Harris, as well. Thank you.
Just briefly, I suppose just to say to the Senator, all of us on a daily basis have personal stories to be related, Minister, around cases we find in our work as public representatives. And I suppose for me, what's needed is to deep compassion and support to those families at a time when people are suffering because of whatever has happened to them, and particularly when they're waiting for appointments and to have surgery as well. Senator, I will pass on the details of the individual to the Minister as well, and I will ask him to come back to you on regards to case itself, specifically around the waiting time. So I will get more details on it.
Thank you, Senator. Thank you, Minister. And finally, I think